Since the advent of COVID-19 in the world for almost a year, and particularly since it was first detected in Nigeria on the 27th of February, people have come to terms with the fact that it's a highly infectious disease that is currently spreading and killing people. We have also learned and adapted to new terms such as frontline workers, PPE, the protective gear, and isolation centers. The iMedia TV crew visited the Idu Isolation Center on the 25th of August in a bid to ascertain the condition of the staff and patients in the facility. This visit was necessary considering the fact that lockdown has been relaxed, businesses are going back to normal, and daily reports from the Nigerian Center for Disease Control is getting less scary as infection cases are reducing. At arrival, the facility team ensured proper precautions before allowing us into the building by making us wash our hands with soap, clean water, and chlorine water. We then proceeded to be disinfected by the chlorine solution spray before we were made to change our footwears and wear the facility's clean scroll. We started to interact with the staff, including nurses and doctors. They explained their working hours, daily routines, general welfare, and change of lifestyle since their work at the isolation center. In the words of a female nurse, "I haven't seen my family for 3 months now. We're all lodged in a hotel. We all resume our shifts from there. This is to make sure we are not putting our family at a risk of contracting the virus. In fact, my people are always praying for me that I should not die." We experienced the staff working hard to see to the welfare of the patients. They explained how uncomfortable it is to be in the PPE for as long as 5 to 8 hours while attending to patients during the ward round. The treatment lead, Dr. Rotimi, likens their job to that of soldiers at the war front. During our discussions, one of the staff mentioned that it is good we are also going to don the PPE to know how they feel spending hours in it. In a bid to see the processes that the medical team go through, we were donned in the personal protective equipment recommended by the WHO for the virus contact precautions and led into the patient arena to interact with and interview some patients. In the female donning area, we were asked to remove virtually all our clothing as anything worn into the patient's arena would not be allowed out of there. After we had removed all our clothing, including underwear, we were given medical scrubs to wear before laying over the COVID-19 protective gear, including the white fluid and stain-resistant overall, disposable socks, boots, hair cover, hand gloves, respiratory nose mask, and eye goggle. The donning process was assisted by a female nurse who ensured all accessories were appropriately worn. We were also given safety advices like no touching of surfaces and maintaining physical distancing with the patients. After proper donning of protective equipment and sensitization, we proceeded into the patient's arena, which the facility staff lightly refer to as the other world. Virtually, our bodies feel heavy at this point, accompanied with a little fear of the unknown. Led by the treatment lead, Dr. Olushiji Rotimi, we climbed onto the 5-floor building using the staircase, visiting patients in their different wards. In the patient's arena, we noticed male and female patients of different ages and agility. While some were found resting in their beds, some were found socializing with fellow patients and playing indoor games. An elderly man who looked past 50 years old who has spent only 4 days here narrates his journey into the isolation center.
I didn't have any symptom, I was feeling well, great. I never thought that I was positive. And I carried my whole of my family. We went, and then the result, after 2-3 days, I took them. I said, it's better let me carry them all so that they can do the testing. So after the 2 weeks, I went, and then I got all the results. They were negative, including my wife. They were negative, but it was only me that when I traveled with my friend. So the gentleman who find the result for me there around 5 in the evening, he said, okay, what can we do? I said, just let's move on. He said, well, but today is already late. Tomorrow you can come to the isolation center. I said, for sure. Where is it? He said, in Idu. Then I drove myself, came.
We also encountered 2 young men engaging in the table tennis sport. They confessed to feeling very fine and healthy. They both have spent more than a week at the isolation center and are looking forward to being tested and confirmed negative to return back home. A young lady testified that the COVID-19 is not a death sentence, as she has seen a lot of recovery during her stay there and is looking forward to returning to her family soon.
COVID-19 is real, but it's not a death sentence. I've met good friends. The people around have been so good to us. They check on us at all times to find out how we are doing. And they make everything available. If it's your drugs, anything you ask of, if you just complained, you get it. So many people have come and they've tested negative and they've gone.
Just after our tour around the patient's arena, we had grown weary at this time, and this was all just in an hour compared to what the medical staff go through staying 5 to 8 hours in the PPE while doing the ward round.
So far, we have seen patients, we interacted with them, we talked to them, they told us about their lifestyle, how they feed, how they do their routines, their daily routines, and all of that basically. Unfortunately, so many people are still out there who don't believe that COVID-19 is real. They don't believe that COVID-19 is still existing. They think it's a joke, it's politics and all of that. So that's why iMedia TV has come to, sensitize the people, to let them know that COVID-19 is real. There are real patients here. There are people who have been here for days, who are undergoing treatment. Some of them are saying they feel better now. Some of them were brought in very sick and all of that. And they are of different ages. We've seen the elderly people, we've seen young people, we've seen different kinds of people. Some of them said they don't even know how they contracted the virus, and some of them, they could tell. But thankfully, they all went for the test willingly, voluntarily. They went for the test, and then when they got the text message and calls that they were positive, they had to report themselves to the Idu Isolation Center here. And they all attested that they are very well taken care of. They commended the officials here. They said they're doing good, and we hope that they have a safe recovery.
To put an end to our exhaustion, we embarked on a rigorous process of disinfection and removal of PPE. This process was carefully guided by staff who warned that not following the correct process of disinfection was very risky. After we had pulled our PPE and medical scrub, we took a bath with soap and clean water before we were able to put on our outfits. We just finished our disinfection and we have been certified free to go mix with other people. We had our bath, done everything possible, and we are safe now. Aditana Halima, iMedia TV.